Around 28 weeks in pregnancy, my ultrasound images started looking suspicious. They could not see a separation between my placenta, my uterus, and my bladder. I have placenta percreta. The placenta can go completely through the uterine wall, out to the other side, and invades nearby organs. On July 16th, 2014, at 33 weeks pregnant, I was brought into the main Stanford OR with a team of 30 multidisciplinary surgeons and nurses. And they safely delivered my son, Leo. He did great. So when it came time to assess the placenta, the invasion was much worse than expected. In an unprecedented move, they decided to abort mission on the surgery. So they stopped and closed me up with the entire placenta untouched, still inside my body. They were worried that I would get an infection, that I would start spontaneously hemorrhaging, but there was also this thought that maybe the body will start to reabsorb the placenta. Maybe this will actually work out on its own. We just really didn't know. I felt like a time bomb waiting to explode. I was in ICU for 3 days, and when I got transferred from ICU to F3, they must have done some serious behind-the-scenes coordination in order to bring my 3-day-old baby from his isolate in LPCH to my room on Stanford's F3, a gyn-onc floor. It was well after midnight, but we hadn't met yet, and his NICU bassinet still didn't have a name. The empathy of my team and their ability to see that bigger picture and to just make something happen to give me a much-needed morale boost. I had something that I needed to get better for and to get back to. I stayed in the hospital for 6 weeks in suspense, and then one day I started developing bruises all over. A blood test revealed that I was approaching liver failure. When Leo was 7 weeks old, I underwent an emergency operation lasting 8 hours. It would take the removal of some unnecessary organs, repairs and interventions to other critical ones, and the transfusion of 26 units of blood products to stabilize me. And I asked my gyn-onc, if I'm about to have this major surgery that no one wanted to do under the best of circumstances, how am I going to heal? And she looked at me with her eyes full of tears, and she said, "We're all discussing that right now." And the way that she answered was so honest and so authentic, because it really reminded me that there were all of these people that I had really gotten to know over the past 2 months. And they were so incredibly capable and so personally invested in my outcome. I knew that I was at the right place. They were going to do everything that they could possibly do. It's been a tough road, but I've made a full recovery. And you'd never even know that Leo was a preemie. He's a feisty and determined 1-year-old, and we're pretty convinced that my mutant placenta gave him some X-Men powers. As a patient, I didn't know that CI Care existed. I didn't know what it was. I felt all of the things that I, now knowing what CI Care is, I recognize them without having a label for it. As I've become a volunteer at Stanford and have learned what CI Care is, as soon as I read about it, I had this like, oh, that's the magic. They actually have this spelled out in how to do it, because they're definitely achieving it, and achieving it in a genuine way. I felt like I had this team of advisors, this team of people that were rooting for me. There was a surprising level of impact with the little things. People coming by my room to say hello, calling F3 labs miles, the little things that people remembered about their interactions with me that they would come back and reference. There were so many people who were genuinely concerned about me, a stranger to them. And now, when I look back upon my 2 months at Stanford, it's the human experiences that really leave me in awe.